Hello, I'm Marty Kyle, Director of Health and Human Services. Washington County had the first reported case of COVID-19 in Oregon on February 28, 2020. I will never forget that call from my Public Health Division Manager. Since that very moment, public health, all of HHS, Health and Human Services, and frankly, our entire county workforce has been focused on limiting the spread of COVID, preventing hospitalization and death, and addressing the severe emotional and economic impacts the pandemic is having on all of us.
Everyone is very aware of how the COVID-19 pandemic has affected our communities. Here in Washington County, local public health is fighting the biggest communicable disease outbreak we could ever imagine. Everyone has learned the term contact tracing as part of this pandemic, but there is so much more that goes into protecting the health and safety of all individuals and community in an outbreak. Currently, more than 175 staff are employed in the work needed to fight, including case investigation, contact notification, isolation and quarantine, workplace outbreaks, long-term care facility support, and school support, communication, and education. The list seems endless.
Hi, my name is Nicole Garcia Duffy. I am a case investigator with Washington County's Public Health. What that means is that I am probably one of the first people after an individual receives their positive test results that these individuals speak with. And so it's my job to connect with them and gather some additional information about their symptoms, their housing situation, their employment situations, and how all of this is being impacted, and hopefully connect them with the resources that they need to weather this experience that they're facing, so that we are able to connect with these individuals and to share just some comfort and encouragement and the compassion that they need as they're pretty afraid of what happens next. One of the biggest fears for everybody that I've spoken with is what's going to happen? What am I going to do about rent? What am I going to do about food for my family? How can I stay home if I have to provide? And knowing that these resources are available and being able to step in and say, we don't want that to be one of your stressors, and here's how we can help. You can almost feel the weight come off of their shoulders, knowing that they're not going to lose their home, or they will be able to feed their families, as well as stay home to protect themselves and allow their bodies to heal. And so it's just been such an amazing experience to be able to reach out to the community and offer some hope in what feels sometimes like a hopeless situation.
We were only able to respond to this pandemic at the level needed for our community because of coronavirus relief funds. This allowed us to hire bilingual, bicultural surge staff to ensure we reached everyone in our community, but especially those most impacted. In Washington County, almost one half of our cases identified as Hispanic, despite less than 20% of the population in that demographic.
Our public health team jumped into action using science and learning along the way. As you heard from Tricia, we have had to add over 100 staff to perform the important functions like case investigation, contact tracing, support for people and families in isolation and quarantine, and responding to outbreaks. In addition, our Emergency Management Office initiated the Emergency Operations Center to support the public health effort, and our county administration and support services also shifted their priorities to support the county's COVID response.
My name is Ruby Vergara Grindel. I work for the Public Health Institute, working for Washington County Quarantine Support Team, as well as the Resource Coordination Team. So I have two roles within the Tracing Health program. One of them, the resource coordinator role, is to assess clients for financial eligibility to receive resources from the county during their quarantine or isolation period, and then refer them to a community organization that will be able to fulfill their needs. And then my other role is I work for the quarantine support team, which is a team within the Washington County that directly provides bill and rent and food assistance, as well as any other wraparound supports clients may need during their quarantine. So I thought that I would just share, first of all, one story from one of my clients that I thought would really sort of show what a lot of people are going through in this time and how our program can be really helpful for them. So I'm going to call this person Rosa. That is not her real name. But when I was assigned Rosa's case as the quarantine support case manager. So I was actively providing her bill and rent assistance as well as food during her quarantine. And Rosa is a single mom. She has 5 kids and she was COVID positive. And her COVID symptoms were very severe. She had symptoms for around 2 months, and so wasn't able to work for a full 2 months. And luckily, because we do, up until this point, have had the option through an extended assistance application to provide 2 months of service. Normally, we just provide 1. We were able to provide Rosa with 2 months of assistance, which was really helpful for her. Also, she was having a lot of mental health problems related to the stress of going through COVID, of having to care for her children while being sick. And so I was able to set her up with the COVID counseling program that we have available to clients. And she was able to have phone visits with a counselor that was really helpful to help her manage her mental health. And also, while I was working with her, her daughter was actually in an abusive relationship and her boyfriend threatened her life. And so I sort of walked her through that process of just, emotionally processing that. I provided domestic violence hotlines for her daughter, and also her daughter started going to therapy. And luckily now her daughter is able to be with family in another state and is safe. And Rosa is is more emotionally stable and has recovered from her COVID symptoms.
As federal funds end on December 30th, we are acutely aware that our important work cannot continue at the level needed to keep everyone safe. Staring at this fiscal cliff at the same time that our cases are at the highest level ever, and we need to plan local support for vaccine rollout, is extremely overwhelming. As the local public health administrator, I'm concerned not only about the safety and the health of my community, but the well-being of the public health workforce. Our staff need certainty that we will be able to continue to provide them with stability and adequate resources to do their jobs and protect our community. We cannot end this pandemic without financial resources from the federal government. We urge you to continue to work to fund public health response for the COVID-19 pandemic.
If we didn't have this program going, people like Rosa and others, they wouldn't be able to make it, unfortunately, because again, often COVID is hitting people the hardest who are already dealing with these underlying social situations that aren't providing them enough support, so they are people who do not qualify for governmental assistance or are already working jobs that do not provide them with health care. And so again, this program is just a really vital lifeline for a lot of people in our community here in Washington County.
As you know, our cases, hospitalizations, and death rate continues to rise in Washington County, and this will not stop on December 30th. Critical is not a strong enough term to describe the need for ongoing federal funds for continued local government response. Thank you for your time and your efforts in supporting our needs in local communities.